in terms of the pediatric setting, because obviously that's where you work, what's your advice for parents on how best to protect their kids, many of whom, age 5 and under, all of whom cannot get vaccinated?
Really important question. So first, let's start the older group and say, if your child is eligible for vaccines, we absolutely encourage you to vaccinate your children. We know that is still the best way to protect them and therefore everyone else around them from getting infected or at least getting a serious infection. And of course, 0 to 5s, that's a tough group, right? It's a group that just loves to be rambunctious and get around and be involved with lots of people. And so for now, at least, when they are in close settings, where they're indoors, where there's poor ventilation, when there has difficult ability to socially distance. Unfortunately, right now, I think wearing a mask is still the best thing we can do for them. And obviously, everyone else around them, the caregivers, the older people who are around them, should be vaccinated to help protect them as well.
So we've seen the mask mandates go by the wayside in schools, by and large. What would be your recommendation to a parent? Forget the public policy. To the parent who's just concerned about their kid in the classroom, what do you say to them?
I think, again, if your child is old enough, vaccinate them. That's going to be the best thing to do to allow them to be mask free and to go on with their normal activities. I think if we all have to assess the level of risk we as a family are willing to take on. If you know in your household you have elderly people, you have people who are at higher risk because of immune suppression, because of an underlying condition, it would be reasonable to tell your child and have your child wear a mask in school. I can tell you, one of my children, who I have 2 school-age kids, she still chooses to wear a mask because she feels more comfortable. So I completely support it. So I think that's something we all have to kind of grapple with in our own daily lives and family lives.
You know, I think everybody is looking at this through the prism of what's best for me, what's best for my family, and 100% get that. But, you know, in the beginning of the pandemic, when we were looking at measures to try to stop the spread, that was the goal. And the results, maybe not what we would have wanted. But do you think that kind of messaging needs to return to a certain extent, especially when it comes to trying to convince people to get vaccinated, which has not been easy to do?
Well, I appreciate that question. I think it's really important. It's one thing that we probably could have done better earlier on, and definitely continue to try to do, is spread the important message that all these mitigating factors, particularly mask wearing and vaccinating, it's not just to protect ourselves individually or even our households. It's really there as a public health 101 measure to help reduce the risk of spreading the infection that you may have, even at a mild or asymptomatic case. You can prevent spreading it to all those around you who may be vulnerable. So it's really important that we consider everyone else around us, not just ourselves.